So without further ado, I would like to introduce you to our two speakers today, literally on the other side of the planet to us here in the UK. First of all, I'd like to introduce you to Leonilo Rivero, who's known as Bem Bem to us today. Thank you very much. Who is the village director of the Children's Village in Davao City in Mindanao in the Philippines. Now, Bem Bem has been working in the village itself as director for over a decade now, and he has the unique vantage point of actually having been brought up in one of SOS Children's villages in the Philippines. So thank you very, very much, Bem Bem, for joining us today. We greatly, greatly appreciate the time that you've taken out of your schedule. Also joined by Michéle Mansor, who is Program Director at SOS Children's Villages in Brazil. Now, Michéle has over 30 years worth of experience as a social psychologist, particularly working in the areas of prevention of HIV/AIDS and in human rights, and particularly dealing with children and young people with high vulnerabilities. Again, Michéle, thank you very much for joining us today. And I know we say a good evening to Bem Bem and a good morning to you, Michéle. Very, very grateful that you could spend the time with us today as well. Now, I think, Bem Bem, you had something that we could start our conversation today, direct messages and voices of some of the children and young people that you work with.
Good evening, good afternoon, and good morning to all who are present here. I'm happy that I could join you tonight, at least today for all of you. Yes, I've been in all my life, perhaps, as a former search child and a former, now an employee or a village director in SOS Children's Village. And I have seen how our organization changed and how we respond to every possible scenario, especially those difficulties that the children encounters, and how we achieve all those things. But it's not different now. But at the same time, I think this is also unprecedented, and it changes the way we live, actually. And as far as SOS Children's Village is concerned, there were a lot of changes. There were a lot of challenges, not only for our children and the communities that we help, but also at the same time our SOS parents and how they deal with it. And right now, even it's already been a year already since the initial declaration of the pandemic. We are still currently having this hard lockdown still because of the fear of second wave and the very slow vaccination program in our country that we have. So while our country and the community is dealing all this about handling or responding this pandemic, our also village inside aligned with it and try the best we could to let the children understand the reality of all this happening and the change that we are going to deal with. And of course, with that, I took some notes on how to do it, which I will share a little bit later. And all I want is really to let all others learn what we did and what we are doing right down here in the village at the ground level. The way we deal with children and young people, our challenges, our SOS parents and the support co-workers in the village, and of course, the community that we are also helping. As you know, we also have family strengthening programs. We also have community programs that deals with children and young people also, not only the families that we help, but our neighboring communities also. Yeah.
Great, thank you very much. Michéle, it would be great to hear a few introductory remarks if you can capture the effect of COVID-19 on children and young people in Brazil in a few opening remarks. I know that we hear see a lot about the impact in Brazil in particular. So give us a sense of the context from your point of view in the same way Bem Bem has.
From Brazil, it's good morning to everybody. Not a very shiny day. which is not quite usual for us, but I guess I think it's a great day here today, because yesterday we just reached the dreadful mark of 3,000 deaths in 24 hours in Brazil. So that is definitely a very sad day for us today. The pandemic has stricken the country in a very serious way. We are facing a huge collapse, not only in our health system, but also in our funeral system and in our social system. So we're dealing with very difficult, I would say more than challenges, a very difficult situation in Brazil that reaches everybody, but reaches especially the most vulnerable people. Brazil was already facing a hard time before COVID-19. So 2019 was a difficult year for us already. And the pandemic situation brought us to another level. If you see the curves of social declines and inequalities since the beginning of the pandemic, and as Ben was just saying, it's 1 year that we're facing this situation. And the problem for us in Brazil that we don't see the way out. So it's difficult. The families are dealing every day with the challenge of surviving the virus, but also finding a way to put food on the table. So it's difficult. It's a very difficult situation. And it's reaching differently people from most vulnerable places in the country, but also from the most vulnerable situation. Recent data shows us, although we don't have much studies in the country yet, but recent data shows that the most poor people are the ones that are dying more. So it's different from the start of the pandemic situation. Brazil, the pandemic came, the virus came from the people that were traveling abroad. So the rich people who had money to go into a plane and travel abroad. But it spread very quickly through the communities. I don't know how many of you have noticed of the situations of our very known favelas, where people live very near each other. So distance isolation is very hard to do. Social distance is very hard to do. So, well, it is a sad day for us. Unfortunately, I wish I could bring some more happy news, but unfortunately, it's a very difficult moment from Brazil. And yeah, I think it's time for SOS to step in and assume the place it always have been doing in big tragedies around the world. So I think it's time for us to do that here as well.
Thank you, Michéle. And certainly, our hearts go out to you and your colleagues faced with those kinds of milestones. It really has been, words kind of don't capture it appropriately, the most incredible year for the work that SOS Children's Villages has done. And I think you rightly highlight that space that we work in, where there are such disparities and inequalities in communities and populations. And that's where we've always worked, in fact, but the virus has made that so much more extreme and so much more obvious. I was reading, thinking about a particular, partly because it plays out here in the UK very much as our particular impact has been around access to education for children and young people. And I read a statistic earlier this week which suggested that 1.6 billion children were out of education at the height of closures of schools. So I was wondering, Ben, how is it that you have responded to the educational challenge with children and young people in your village community?
At first, when we were told that there will be no more face-to-face education, and it was kind of shock because the schools here, especially public schools and other small private schools, are not ready for that. except for the bigger colleges and the universities, they have enough digital head start in the digital way of doing things, but then not all. And not only in Davao, but almost the same picture in the countries. So most smaller private schools, they shut down, and public schools went to the modular system because they cannot go to digital, because kids in public schools, and our public school system is still, not yet ready for the digital way of doing things. And most of the students and the children who are in rural areas and in not so rich or not so better financially stable families, they don't have access to gadgets and tablets and laptops. So our government decided to do it in a modular way of doing things. They have this lesson module and send it to the house and let the children do the work, then return it to the school. But of course, the implication is also is that the mothers or the parents, especially in SOS mothers, become now the teachers, and they are not also ready for that, and they are used to, after tending the children, bring them to school and wait for them when they come back. But this time the kids are there, and if you have like 8 kids of different level, then you have to deal with these things. And our educators, our volunteers, they cannot go there because of also the restriction. They cannot help. So it was really hard first. And the mothers also were not used to doing online, assistance, online, making use of the gadget. Other than the fact that we lack those laptops and these gadgets for the children. And we also have, like, for example, in Davao, I have about 20 to 25 college students, also young people who are in the universities and living in the boarding houses. And since there is this pandemic, we recall them back to the village to stay in the facilities and the family houses. And the ratio of our students to the number of gadgets or digital gadgets is like, for one laptop, they were going to share, like 5 students will share. And it's really, really terrible. And even as I speak, we have this problem of whom to and who, despite that we have the internet because of the digital village program way ahead, but we lack all those things. And that's one thing that we really need. And the other one is it increased some, vulnerabilities in the mental health aspect of our SOS parents, because they are not only tending the children and running the household, they are also teachers, and they don't want their children to fail. And the support coworkers, they just live there. Like, for example, if you are a social worker or you are an educator, you live behind your usual job, but you are the one who go to the public schools to get all these modules, return these modules, and of course in a very restrictive way also, because of the restrictions that the government imposed in our movement. So it's really, really hard. So as a whole, there is challenge in the access because of lack of laptops, and of course also it adds burden to our SOS parents. But the good thing there is that our SOS parents said, no, we are mothers, we are here, we are going to help our children, despite the fact that for almost a year, they did not have day offs. They didn't even go back to their own families. They're also wondering what's going on with their families, but they decided to stay put and be with their children. And of course, we do a lot of activities to at least alleviate some of the burdens within the village. And it also gives us the opportunity for what we call a youth-led activities, wherein older children and young people are now the one handling the village activities, because the co-workers cannot go and have contact with them, because I have very strict health protocols in the village because of this pandemic. So yeah, the digital divide is very clear. And even until today, we're still looking for friends or donors who would like to support us with all this, because my dream is to have at least for our senior high school and college students, at least one laptop to one student. Because at the end, this will be also the answer of our employability and employability for our young people. During the pandemic, when the pandemic was announced, we have, I think, we have 4 who just finished graduating their college and they're working, but now they have to contend with the unemployment rate, which is high, and almost 75% of the economic activity in the Philippines halted, and there is about 16% more underemployment, meaning they have a job but they have to only go for like 3 days because the company cannot bear already the losses that is going on. So that's really as to the education is concerned, it's really hard, wrecking. And as to the modular system, while it is good, the quality of education that the children will get is very much low compared that they go to school really in an actual face-to-face school, because there are so many. All they have to do is just answer very fast, just to comply, and of course the mother will have to do it also very fast because they have other things to do in the family house, and the quality of education definitely went down. And for our young people also, they really have to struggle with their submission of online examinations and other digital learning program, because not because they lack the access in the internet, but because lack of the gadgets and the necessary tools for their learning, which I believe will take effect when they start looking for a job.
I never cease to be inspired by our SOS parents and the people who work directly with children and young people, and that's part of the SOS uniqueness, isn't it? That we establish these long-term relationships with individual children, because it's in that space of that relationship where children really thrive. But gosh, what a challenge this year has been for the people who do take on those jobs, for the SOS mothers. And certainly nobody remembers the trigonometry they learned at school, and now to have to try and transfer that very limited remembering onto their children is an incredibly difficult, challenging thing to do. Michéle, what kinds of impacts have you seen on your staff and your SOS parents and your community and youth workers in the pandemic?
I think this education point that you just mentioned and Ben was just describing here is a very important point that we should highlight in COVID-19 situation in Brazil, because it affects differently the different children. And yes, we are a very special organization in terms of what we can provide for our children. Although we work with high vulnerable children that are facing such challenging situations that they had to leave family to be with us, the children living with us are in a very far more better situation than the children in communities, or at least at the poor communities. Because the problem in Brazil is that schools are closed, public schools are closed, all schools are suspended now because of the pandemic situation. They were open until 2 or 3 weeks now, but they've been closed now because the situation has been very worrying now. But even when they were open, only 30% of the children in Brazil in public school, 30% had access to digital or online classes. And of that 30%, only 3% could make to complete 1 full day of activities. So we're talking about a lot of children with no access to school. At the same time, the children who attend to private schools, and that is in Brazil, you know, we have private schools and public schools that already have a huge difference in terms of quality of education. And those people, the children and young people in the public schools had full access to education because they had ways to do, the schools were prepared. So you can imagine how the curve of inequality that was already existing in the country now has done this big drop. In Brazil, we have a system to access to universities that you have to do a major test, a national test for public education. And the overall of grades this year increased because the only people who actually went well on the tests for universities were the young people from private schools. So you see how these inequalities impact severely in this inequality we have in the country, in the overall view. So we don't have any study yet how this is going to impact or how this has been impacting. Actually, I don't know how to say that in English, but we have a quote in Brazil that we say, we change the bicycle tires while you're driving the bicycle. So that's exactly what we're doing now. We're trying to deal with the situation while it's going on and trying to measure the impact. But I'm telling this example to mention that although our children, again, who live in the village with us, or even in the communities with us, are still very vulnerable. Yes, they can count on our SOS mothers, on our SOS fathers, on the technical staff, on the support we can give them, so they are in a better situation than the children in communities. I could share you, I have some pictures here to show you how the communities are organized, and people don't have access sometimes to electricity, so how can they have access to internet or telephone? So even if we could provide a device, they wouldn't have how to connect. So yes, it's been quite challenging for us. And at the same time, just to mention what Ben was saying, that's very important, dealing with how to prepare our SOS mothers and SOS fathers to cope with the situation. Now, there are 9, 6, no matter how many children inside the houses, they cannot leave now. Of course, in Brazil, we have a model not only in villages, traditional village, but also we also have community houses. So yes, they can eventually have 1 or 2 minutes to play outside, but most of them are inside all the time. So yes, it's been challenging, and it's been kind of reinventing ourselves how to do things. So yeah.
Thank you. If you've got some photographs, I mean, that would be lovely. Are you able to show those to us now? Are you?
I was talking mutually. Let me share with you some pictures. Let me see if I can do that properly. Can you see them?
We can see your desktop. Yes, lovely, thank you.
So that's the kind of communities we are working in. So you see, there are no wires at all. These are all pictures from very recently taken. So yeah, and these are crowded public transportation. So how can people protect themselves if you have to deal with that kind of situation to provide food on the table? And people are still working in that kind of activity. So just to show you a child living in a favela, and I was saying that's a very crowded neighborhood, I would say. So how to do social distance living like that. So yeah, it's quite challenging. I have a lot of pictures here to show you. This is a child that is from one of our programs, one of communities in the very north part of the country, where it's very, very, very hot, and they don't have many access to water. So again, talking about education, in order to survive, or in order to bring water home, what choice this family have. And one thing I would like to show you back again, this is a picture from Rio de Janeiro. This is a picture from the north part of the country. This is a picture from São Paulo. So although we are very culturally different, we are very, we even speak differently in Brazil. Brazil is a quite huge country. You can see that inequalities, although we're talking about São Paulo, which is the richest town in whole Brazil, or we're talking about Manaus, we're talking about the same kind of challenging here. So yeah, I have a lot of pictures. The program sent me. I could show a lot of them to you, but the point was to show you how hard it is for these children or these communities or these people to have access to, for instance, education.
They're extraordinary. Michéle, thank you for sharing those. I think they really do bring home quite how those disparities that you are talking about, and then so the challenges that you and your team face in delivering our day-to-day programs with communities, let alone trying to encourage social distancing, mask wearing, staying at home, and so on. Bem, I think you had a video. Did you want to show the video from your children? Is now a good time for that?
I would like to ask if we have a colleague in our national office. We are the one who set this up.
Right.
Yeah.
Oh, here we are, by the magic of...
Missing my classmates.
Gusto ko pong mangyari na pumasok po sa school.
Yung hindi na po ako nakakapasok. Tsaka hindi na po makapunta sa mga mall.
Mas gusto ko po mamasyal kasama ang kaibigan ko po.
Namimiss ko po about going to school is yung mga yung turo po ng mga teachers face to face. Kasi po sa panahon ngayon, online learning, like self-study na po yung ginagawa natin. Tayo na po yung nagtuturo sa sarili natin. Parang di tulad nung sa face to face na para pwede mo tanungin yung teachers sa harap-harapan.
Ang best thing po na nangyari sa akin is yung nag-banding po kami kasama po yung kapatid ko, and then si Mami Yang po. Masaya po kasi po nagkakasama-sama po kami dito sa bahay. Yan ba?
More time with family.
Tutoring my siblings. They're reading books and helping my mother do the household chores.
Plano ko po ay maglaro-laro muna po. At saka po mag-module.
Gusto ko pong magbakasyon kasama po yung mga pamilya at saka friends ko po. Kasi po dahil po sa pandemic na nararanasan po natin ngayon, marami po tayong stress na nararamdaman. Kaya po gusto ko pumunta ng bakasyon para po ma-relieve po yan.
Unang-una po, gusto pong pumunta sa simbahan. Siyempre po, para mag-thank you kay Lord dahil natapos na yung pandemic.
Oh, that's really lovely to hear their voices. I get a really strong sense from that about the power of the connections that they have in their families, with their school friends. And so that makes me think about once those connections sometimes are broken or postponed during lockdown, the impact that's having on children's kind of well-being. Ben, what have you seen, and what are you doing in the village around that issue?
The first half of the pandemic, I was so strict, and they stay in their own houses. But then as we already learn how to regulate the whole thing, and because they are exclusively in the village, I started to let them now play around the village. And the mothers are really, really good. They are creative. They did a backyard gardening, changing their landscape. Then at the same time, they learn more about their children, those behaviors that they do not know. and and then we continue their football and rugby games. And I also conducted leadership training, especially for the older kids, so that they will be the one to facilitate the games without asking help from outside, of which we cannot do. And the educators and social workers only uh, assist by way of webinars. And I gather children, and there are these webinars, and then it's being shown to them, and they start implementing the program. Then we also have, just recently we conducted this mini village camp. They have a camp but inside the village, but outside their family house. At the same time, I let the SOS mothers have their wellness break. I call them wellness break, an overnight outing in an exclusive resort nearby, wherein they're the only people there. Then, so that while they're out, bringing, taking the hit off about their being, imprisoned in a way. The kids are also outside the house. They're also doing a lot of activities for just to let it out, all this angst and stress. And then they have a lot. They share about their realizations, their fears, and also I facilitated also one activity that focuses only on how we can make positive out of this. And one kid said, the only positive that we don't want is to have a COVID positive infection. But the rest, they turn the bleak and grave moments of pandemic into they try to highlight that they were with their mother, they become closer, they learn more about themselves. But of course, they miss their friends outside. They miss their classmates, and they miss in going to school. But at least there's no more denial on their part that this is really happening, and everybody. This is not only. They also know that it's not only. They are not the only one experiencing this. This is many children, and in fact, they learn that they are even more lucky than their counterparts outside the village. Because sometimes before pandemic, they are joined by children outside the village in their sports activities and other activities. But now there is a clear divide that the kids outside cannot enter the village, and they cannot play also other children in the village. But this has to be accepted. Another one is, even if they are in the village, but if there is some areas that they will going to move, they will have to do this minimum health protocol standard, even if they are still in the village, because we are pushing them to teach them this new behavior. Because sooner or later, especially our young people, in the next quarters, they will be moving out and going back to their boarding houses, to their pre-employment facilities, for example, and they have to accept that this is now the new way of life. So even if they are still in the village, they will still have to follow some sort of an exercise by doing what the government is trying to teach us, this strict medical, health protocols, like wearing masks. And even if they will say, but we are not contaminated, we are not outside. Yes, but the point is for you to learn this behavior, because whether we like it or not, it's a changed world, it's a new normal. Then this will not, the effect of COVID will going to last long, in 2 to 3 years. So they have to learn that new ways of doing things, especially our young people. So yeah, we have a lot of that. We are very happy to say that in SOS Children's Villages in the Philippines, there is no report or recorded that there is a case. And sometimes they feel that we are very strict, but we'd rather be restrictive than, you know, regret at the end. And we're looking forward that the vaccination program of the government will really roll. But of course, there's always this downside, because next year would be a national election year, and COVID response is being politicized both in the media and in the local communities. And that's another problem that we have to deal with. But I hope the vaccination will go roll out and we will be avail of it, so that we can move on with our lives.
Yeah, indeed. I think we all agree with you on that one. We're getting a couple of questions coming through from attendees. So Michéle, I'm going to ask you, if that's okay, one of the first questions that's come through. And particularly, I think relevant to some of the comments that you were making about the pre-existing vulnerabilities in the communities that you work with. We've had a question with someone saying, with families not being able to work, have there been food shortages in the communities that you work with?
Yes, unfortunately, yes. One of the pictures I have here, I'm going to quickly show you, shows one of the actions we are working on. Sorry, I'm not very good with that. Because we had to establish a very large campaign last year for giving access. This is a card that the families have access to food kits. The idea is that they can buy it on the supermarket, so they can choose the kind of food they like. But last year we did a large campaign on that subject. Over 1,000 families were attended, and we thought that it was okay, things were going to be better. But the government measures actually stopped at the end of the year. They had a financial aid, was about, let's put it in dollars, about $150, but now it has decreased to $30. So yeah, we are facing hunger actually now, and we have families literally knocking on our doors asking for food again. So it's been quite a challenge. We were talking yesterday about what first measures we have to take, because in Brazil you have a public health system and we cannot act directly in health, but we do need to act in a very, very strongly in terms of providing the families to have access to food. The people living in the streets, the number has increased highly. If I could quickly find here, this is a picture from, sorry, I'm gonna find it and show you in a minute. We have a picture from yesterday from São Paulo streets, that entire family living on streets, because yes, poverty is literally on people's houses, and hunger, literally hunger, is one of our main challenges now.
Okay, thank you. I mean, it's kind of extraordinary, the scope of the impacts. Certainly when the virus arrived, we all think, oh, it's going to be a health impact, and this is going to be about treating people and getting them into hospitals. And in fact, the effects have been so wide-ranging, right down to, like you say, the level of food that families have been able to access. Talking about access to things, a question I'm going to put to you, Bembem, if that's okay. Certainly here in the UK, in the early stages of the pandemic, there was a lot about PPE, personal protective equipment, and there not being enough available, so whether that's masks, gowns, visors, and so on. How did that play out in the Philippines? Was that something that you and your communities were subject to as well?
First, at the onset of the pandemic, yes. But as we move on, and our country is very much friend with China. So the bulk of most of our economic, how do you call these materials, especially the PPE, are coming from China, which is a bit cheap, and of course at last year, the onset, it's really very expensive because of the high demand and lack of supply. But now it's overflowing. Gokers can sell, anybody can sell, and it's now really very cheap. So it's not, the PPEs are not really a problem. In fact, in the village, in all villages in the Philippines, we really have that, and we have our own isolation room. We tried to come up with that just to prepare ourselves. We have our own isolation room. We have our own PPEs on standby, and we talk with local governments and other suppliers who wants also to help. Most of our face masks and other sanitary materials, some of them are taken from our friends, local friends, who give us donations, and we make sure that it will be readily available, especially if we need them. So far it's not, the PPEs are not really a bit of a problem in the Philippines now, especially right now.
Okay, thank you. One thing potentially we've all learned in the last 12 months. Indeed, thank you for that. And another question, again, kind of comparing to what's happened here in the UK. There's been quite a lot here in our UK media about the rise in incidences of domestic violence, so people calling helplines and so on. And it'd be interesting to hear reflections from you, Michéle, and you also, Bem, and whether that's something that you've also seen in your communities, and quite how SOS has been able to respond to that. Michéle, is that something that's come up in your community as well?
Yes, it's the rates in violence against women, and also violence against children, and also in terms of sexual abuse has raised absurdly in Brazil. Although we don't have a system very efficient, so for taking those kind of calls. So we think the numbers are even higher, actually, because that was already a problem in Brazil. The numbers, we did know that the numbers were higher than the official data that we have, because it's, it's a problem, cultural problem. The families hide the problem. People do not denunciate. People do not call out. So, but because people are more in the homes, there were more notifications on that kind of incident. What we started to do is we didn't stop working. Actually, SOS in Brazil didn't stop working at all. The only actions we have absolutely suspended, and they are all completely online, protection spaces, what we call this day centers, where the children used to come and stay a period, the children from the communities. And that or youth employability activities, where the young people came to have, training courses. So that's all has stopped, and we're doing online. But all the family strengthening programs are going on, and all our team, all our field team, are doing home visits daily on regular basis. So at least at the families and the communities we are on 31 different cities in Brazil. So we are all over Brazil, from all the regions in Brazil. So we're trying to be more present in people's life, in the homes, actually, trying to be there so we can try to have an action to prevent that kind of occurrence. But yes, the numbers are high. Again, there's still no official study, but the calls in the police centers and the violence observatory center has highly increased. That's another big challenge.
Wow. Bem, what's the situation in Davao in the Philippines as well?
Last year there were reports that there were reports on an increase of incidences, especially in the rural and in an urban poor areas. But in the families that we help, I have here in SOS Davao about 115 families that are under our family strengthening program, of which child safeguarding, gender, and all these child rights and all these women's rights are part and parcel of our program, even pre-pandemic. But yes, there is, but not those families under our care. But SOS Children's Village Davao is part of a bigger coalition of organizations that will all those things, that somebody rescue, someone work on the rescue, we have members in the police force and in local government units. We are part of a network that deals of all this. But generally, yes, there are so much because the trigger, I think, is more economic, and they cannot move out, and kids or young people cannot go to the police because they cannot move, and the abusers are in their house, and the police and other government agencies are very focused on responding COVID. So yeah, there were reports like that. But since we are also active and we have hotlines, we have all these mechanisms in the Philippines, because in the Philippines we are very particular with children's rights and child abuse and right. But there is one segment in this work that we are very alarmed. This is now on the online sexual exploitation, because right now the kids they have gadgets. Everybody's looking at the social media, and these are opportunities for our perpetrators, and make use of it, and sometimes use it as an economic power, selling their pictures and all this, and the parents themselves are the one also are involved, so that they could have money to be brought in. And yes, it's more economic, and there's a trigger, and we are looking at this, and we are very much active in this kind of work in partnership with the local government and other like-minded organizations. So SOS doesn't do it alone, but we are ready. In fact, I'm getting some assessments, because for this year alone in our village, we accepted 21 or 23 children during the pandemic of different reasons, and some of them are economic collapse and abuses of those child care provider before they come to the village. And I think other villages also are experienced like that. But for us, if you have an admission of children about 20 to 25, it's massive, and it reflects the conditions of what is going on outside and what is going on with these poor families, and putting more children in a vulnerable position, especially now in the pandemic, in these pandemic times. Yes.
Thank you. The online abuse, of course, another completely unforeseen consequence of what we simply thought was going to be a health emergency. It's absolutely extraordinary, the impact that this pandemic has had. I see we now literally only have 9 minutes left. I've got so absorbed in listening to what you've both been saying. I'm going to now really, unfortunately, ask you to summarize really briefly anything that you would particularly like to let us know about, or something like that, before we finish our session today. Michéle, is there anything you think we haven't covered, or anything in particular you would use to summarize or highlight what you've been working with and the impact on SOS Children's Villages in Brazil?
Yes, I'm going to try to share a last picture of the 1,000 I have chosen to bring you today. And that was this one. It was made in São Paulo. It is a child living on the streets. And it's not a picture taken from us, it's a picture from the newspaper, and that summarizes, I think, the situation regarding infanthood in the country. And that one point I would like to highlight in this last few minutes is that we're facing in Brazil a situation that it's very was very rare in the last, I don't know, last decade. That's orphanage. So there are children being orphans because of the COVID-19. And that's something that we're still listening about. There are, again, no official data, but we're starting to listen about, and something that's is worrying us very, very much, because we're talking about vulnerable children that when they lose the one or two caregivers, main caregivers, they don't have anybody to go to. And Brazil, unfortunately, at this moment has very few laws or very few protections, a very weak protection system at this point to protect them. So that's quite a situation that we must put on our efforts to support these children and support the families as well. Because again, the society, Brazilian society, because most of us are very poor. So the Brazilian society is in a very dangerous situation. We are a very diverse country. We have enormous inequalities, and this situation of the COVID-19 has brought us a challenge as society. So I hope we can try to learn a lesson from that, get together and help the ones that will need us. So again, thank you very, very much for this opportunity to talk a little bit. And again, we are better together, and that's a way to be together. So thank you.
Thank you. Bem.
Well, one of the massive negative impact of this pandemic is really in the economic side, and the economic impact translate to all other areas of our work. And first, SOS Children's Village Philippines is in its, I think, first year in our self-sustainability, funding, that we are trying to ask Filipinos to help Filipino children and less international subsidy. And this is, and as I don't know, the timing is so it's not so good, because we are asking help, then we are not getting much of the international subsidy, which is understandable because it's in the plan, and we are proud to say that we are doing well. But of course, because of COVID, and it really pull our resources a bit tighter. And with that, our SOS parents, our SOS mothers are really struggling with the food budget, because of the restriction of movement. Even if there's no food shortage as far as agricultural products is concerned, but the inflation, the hike of the prices went up because of the markup cost of delivery, because mothers cannot go to the market now. The markets are going to the village. And of course, the logistic side of expense, they will have to really, mark it up. So vegetable is about 22% high now, and meat is 45% high, and our food budget are still the same. Our living allowance in the family houses, and the mothers really are trying to pull it to make sure that we still provide proper nutrition and proper food for our children, especially now that they are in the house always. And that's one of the struggles, more economic. And the other one, again, due to this economic collapse, the employability of our young people who are now starting their own lives. And they have to compete with those who were retrenched and those employees that has, all the companies that shut down. And it's another competition for them. And we're trying hard to, to work on this. Then, of course, the digital divide as far as the access to digital education is concerned for our children. Then, but at the end, I'm also happy that our SOS parents didn't give up. They stay here. They really, they're always there with our children throughout these trying times. So I hope everything will be, we are still hopeful, because the children are very hopeful. They really, if you always see them every day, you will find this moment of, hope that someday, maybe next few months it will be okay, because they're the one who is always happy. They were always there, and they're even the one comforting the older people, the adults. So yeah, so that's my concern, the food due to economy and the digital divide of the another thing is that why sometimes it's quite hard for us, because while we are dealing with COVID-19, Philippines is, always have these natural disasters. We have a volcano erupting near one of our villages, and we have these typhoons, and of course the help always go directly to emergency and disaster response more than the help to our work in SOS. So we compete also in a sense with that help that we really need, especially now that we are on our way to self-sustainability in running our projects here. So, but then I'm so happy and thankful that I got to get involved with this, and I could share this to people out there, and to those who are more fortunate, maybe they could actually act on it and maybe help other less fortunate, especially our children. Thank you.
Thank you. Thank you very much. We are right at the end of our hour together. Michéle and Bembem, I can't thank you enough. In Bembem's case, for taking time out at the end of his day, for Michéle before she's even started her day, to join us and talk to us about some of these impacts. And it's quite clear to me that these are far-reaching impacts. This is not something which will, even though the pandemic is certainly not over in Brazil, won't be over once the health emergency has been dealt with. These are going to be longer lasting impacts, certainly for children and young people, around their education and their employability, and then within the sustainability of their local communities as well. So thank you for bringing that to real life for us today. It just remains for me to say to our attendees again that we are recording this. There will be a link sent to you to the video up on YouTube within the next day or so. Also to just remind you that we have an evaluation form which will automatically pop up on your screen when this webinar ends. It's short, it's sweet. Please do let us know what you thought and if we can do anything better for the future. But again, thank you all very, very much for joining us today, and thank you very much to my international colleagues. Look forward to seeing you again soon. Thank you.
Bye-bye. Michéle, bye-bye. Alison.
Bye-bye. See you.